This program is presented by Medscape Education Global.
Hello, I'm Professor Susanna Banerjee. I'm a consultant medical oncologist at the Royal Marsden NHS Foundation Trust and a professor in women's cancers at the Institute of Cancer Research in London, UK. Welcome to our 6th episode in our podcast series, and this one's titled Living with Endometrial Cancer, Understanding Patient Perspectives to Improve Overall Care. I'm delighted that joining me today is Maria Papageorgiou, who is the founder of the Erifili Gynecological Cancer Patient Group in Athens, Greece. Welcome, Maria.
Thank you very much for having me. It's very important for us to share our stories and make women understand the difficulties and how to take care of themselves.
Thank you. So, Maria, can we start with what can you share with our audience about your personal cancer journey?
Yes, of course. I was diagnosed when I was 45, 11 years ago. It was postmenopausal, so I had no signs. But for 6 years prior to that, I had a lot of pain. And a simple gynecologist could not recognize the signs because I was still young. So, they couldn't see that it could be endometrial cancer. I'm obese, and as I found out later, endometrial cancer is hormone related. So my obesity probably had a role in getting cancer. Women don't really know about endometrial cancer. They know about cervical, but not endometrial. Maybe because there is no test for that. Maybe because it used to affect older women as well after menopause, and they didn't really talk about it. It isn't a popular subject, not only because of cancer, but also because it has to do with our sex, our nature. Even talking about having our period, it's something that nobody wants to know. But nowadays, more younger women are getting diagnosed with endometrial cancer.
Thank you, Maria, for raising those really important points, in particular about awareness of endometrial cancer. How would you say endometrial cancer affects women?
Having endometrial cancer is very difficult. As I said, it is not only cancer, which is scary enough, but it's our nature, the essence of our being, our womanhood, who is diseased. The first step in treatment usually is having hysterectomy. Even though it's not seen, it is an ampulation. Something is missing from our body. If the patient is young and hasn't yet have children, a decision is taken for her by force for her, and she's left with grief, maybe even guilt, feeling empty. And in many ways, she needs to protect herself from society's standards of what a woman needs to be, a mother maybe. Those are some of the psychological issues that she might face. But depending on the stage and the type of endometrial cancer, she might have side effects due to treatment.
Thank you, Maria. And in particular, now with improvements in treatments, there are side effects and toxicities that are a challenge facing women with endometrial cancer and also the oncology teams. Side effects can be from radiotherapy, chemotherapy, immunotherapy, and also targeted therapies in our practice. And what I often see is general fatigue, as well as some other side effects like nausea or diarrhea. And these can impact on the daily living of women with endometrial cancer. So, what would be really helpful to know is how did treatment affect you?
The truth is that getting in all those side effects are very real and they affect our everyday life. Myself, I had surgery, hysterectomy, radiation, and chemo and brachytherapy. Surgery caused surgical menopause, which has many side effects. Our hormones go crazy. There is loss of libido. Our sexual life has many changes. There is vaginal dryness and the fear of additions. We might need to use a dilator, something that doctors don't really talk about it. We cannot feel like before due to fear, due to changes. Making love can end up being very painful. Talking about it is not always easy. I myself accept all other issues. I also have incontinence. It makes me feel so sexy wearing a diaper. The hormone imbalances also causes problems with our heart. We need to check that too. I have a huge hernia on my stomach due to another hernia I had because of hysterectomy that changes my body image so much. I had hip replacement surgeries to both my hips due to a septic necrosis. I have problems with my mobility. I walk with a cane. The hernia doesn't help in getting my mobility back. I'm taking antidepressant pills. There is also lymphedema that may occur that makes walking and living very difficult. Some therapies also use drugs that cause nerve damage to our fingers and toes. Coming in touch with other women, I realized that my side effects were not so bad. Other women have to face a lot more severe side effects, problems with their intestines, fistulas, lymphedema, as I said, brain fog, even PTSD, and anxiety, and many more. We need support to deal with all those issues, to feel that we are not alone in this difficult journey.
Thank you, Maria. I know that many women will resonate with your story, so thanks for sharing that. What do you think the oncology team do or need to do to support women living with endometrial cancer?
I believe that the oncology team should be aware of our side effects and to be there, giving us the correct advice on ways to manage them, even conducting us to the right person to see how to manage them, to see us as a whole and not as a diseased organ.
Thank you, Maria. You raise really important points here. And it's really important to know how and where to direct women living with endometrial cancer to the right support groups, and also to make sure that those support groups exist. How do you think that patients can get access to support and educational materials?
Actually, this was the reason I founded my patient support group in Greece. I know in Europe almost every country has one. By following different Facebook groups, I see that women all around the world are trying to connect and speak about their problems, their fears, their hopes, their dreams, and their joy when they have good news. It is better when those groups are able to give valid information, to have access to reliable sources, to be connected with the right people. Actually, my group was the it was my doctor that suggested to form that group in Greece. We need the educational materials that will help us become educated patients, to know what are the latest news, to seek for the best treatment possible, to know how to deal with our side effects and the later side effects that we will face. Communication between support groups around the world gives us a chance to see best practices. Asking or even demanding for those best practices for ourselves in our countries may lead to a better quality of life for all women. Being part of Engage, which is the European network of gynecological cancer advocacy groups, gives me access to the correct information and the ability to communicate with other support groups around Europe. There are other networks like that around the world, universal or not. My advice to any woman that wants to get information in order to manage the bad news or to be able to ask for the right choices, the right choices is to seek this information to valid sources.
Thank you. And thank you for your work in creating and supporting patient groups. Maria, could you just expand a little on your work with cancer advocacy groups?
Yes, as I said, being part of Engage give us the opportunity to follow their conferences. When ESGO has a conference, Engage has a conference as well, and then doctors come to our conference and say in lay language things about the new treatments, things about new drugs, about everything that it's so we can understand better and give that advice to women in our countries. Also, on our site, there is a section about brochures that they have all kinds of things about HPV, about endometrial cancer, about all kinds of cancers and problems that we meet, like lymphedema or menopause or a loss of libido or all the problems that we face. And those are written by doctors and patients together, so it's in a lay language that we can understand, and we can translate them into our languages in our countries, again with communication with our doctors in every country, that they say that the translation is valid, it's correct, and that gives the women the opportunity to have the right information, and not anything that is it's from doctors. So it's very, very important.
Well, thank you for that. I think it's really important having that communication in developing the correct advice and materials for patients. Well, what is your personal advice to women in relation to endometrial cancer?
I believe that women should trust the messages their body sends to them. They know best. They know if something is wrong, and they have to trust that even if it isn't what it should be. So if they have symptoms that consist, they need to go to see a specialist, a gynecologist, oncologist. Also to know that endometrial cancer is a possibility to younger ages. And also I would suggest that they should never forget to go for their regular checkups at the gynecologist.
And that's a key message, a very important message for our audience. Thank you, Maria, for sharing your personal experience and what you have learnt through patient groups nationally and worldwide.
Thank you very much for having me.
Thank you for participating in this activity. Please continue on to answer the questions that follow and complete the evaluation.
This program was presented by Medscape Education Global.